Welcome to Science Easy Tech channel. In this video, we are going to discuss about body defenses and immunity. So, this topic comes under Unit 1 in the subject Nursing Foundations. This video will be useful for Bsc Nursing students and post-basic Bsc Nursing students. Body defenses and immunity. Individuals normally have defenses that protect the body from any infection. So, we will be having some specific defenses and non-specific defenses which will be protecting our body from any source of infection. So, the defenses can be broadly categorized into two types. What are they? Specific defenses and non-specific defenses. What are specific defenses? So specific defenses protect the person against any identifiable bacteria, virus, fungi and other infectious agents. So what are specific defenses? They protect the person from any bacteria, virus, fungi or other any infectious agents which are identifiable. That is, priorly you have an exposure to a particular disease condition. After that, once again you are having some recurrence or reinfection means, so the memory cells immune system will be knowing how to act accordingly. What are non-specific defenses? The non-specific defenses protect the person from any type of infection, whether it can be a new infection or old infection, any infection, it will be protecting us. That is called as non-specific defenses. So before seeing detailing about specific and non-specific defenses, I request our viewers to kindly subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. Let's move on to the detailed explanation about non-specific defenses. Non-specific defenses include anatomical and physiological barriers and the inflammatory responses. What are these anatomical barriers, physiological barriers and inflammatory response? We will be seeing in detail. First, we will see the anatomic and physiological barriers. So, intact skin and mucous membrane are the body's first line of defense against microorganisms. So, first we have to see intact skin. Our skin and mucous membrane is the first line of barrier to any organism. So, our skin and mucous membrane will be protecting the body from many types of microorganisms. So, it is a natural barrier. It is a natural barrier. Suppose if our skin and mucous membrane has been injured, has been cracked or broken, what will happen? The natural barrier is going to get disturbed and easily bacteria, virus, fungi, everything can penetrate and go into our body. So normal secretions make the skin slightly acidic. Acidic environment inhibits bacterial growth. Suppose the secretions like tears, saliva and vaginal secretions. So all these mucous secretions are acidic in nature. So for example, the best example is vaginal secretions, so which is having the lactic acid. So this and all is going to what? Inhibit the growth of many bacteria. The acidic environment will be inhibiting the growth of many bacteria. The nasal passage filters air. The cilia, the hair which is present in the nasal mucosa will be filtering the air and keeps mucous membrane moist. So which is helping in this process? The cilia or the hair which is present in our nose, so which will be acting as a filter of the air what is going inside, and also it keeps the mucous membrane very moist. The oral cavity has a regular flow of saliva. So the oral cavity will be having regular flow of saliva which helps in preventing of infections. So the saliva also helps in partial digestion of starch as well as it helps in prevention of infection. In eye also, in tears we have lysozyme enzymes, so which is acting as a natural barrier and it will be washing out all the microorganisms. Whenever any foreign particle, any dust, any infectious, anything if it falls, so most of it if it comes by means of tears. That's why in case of any eye infection also, as a natural barrier mechanism, you will be having watering in the eyes or tearing in the eyes. Next is vagina. So in vagina it also has natural defense against infection. When a girl reaches puberty, I already told, lactobacilli ferment sugar in the vaginal secretions, creating vaginal pH 3.5 to 4.5, which is acidic medium. So when the girl reaches puberty, so you will be having vaginal secretions, white discharges, that is nothing but due to the fermentation of sugar by the lactobacilli. So lactic acid secretions will be formed. The vaginal pH will be changing to what? 3.5 to 4.5, which is acidic in medium, which will be preventing many disease producing microorganisms, mainly the bacteria, fungi, etc. And also the urine flow. Okay, the urine flow also will be washing out all the bacteria which is presenting in the urethra, lower part of bladder, everything. So this will be preventing further what? Ascending infection. Ascending infection means from urethra it will spread to the bladder, from bladder to the ureter, and from ureter to the kidney. So this is called as what? Ascending infection. So this will be prevented by means of washing out of bacteria by the urine flow. So next we will move on to inflammatory response. Inflammation is a local and non-specific defense response of the tissues to an injurious or infectious agent. Whenever our tissue has undergone any injury or any infection, the first and foremost thing what is acting in locally is a non-specific inflammatory defensive response. So inflammation means there is some site of infection or some sort of infection or some sort of injury to the tissue. So it is an adaptive mechanism that destroys or deletes the injurious agent, prevents further spread of injury, and promotes the repair of damaged tissue. It is characterized by 5 signs. So whenever an inflammation occurs, so your tissue repair or your body defense starts acting. So that is a inflammatory response mechanism. So there are 5 signs in inflammatory response mechanism, which is very, very important. First is what? Pain. Pain is called as dolor. Then next is swelling. Swelling is tumor. Redness is rubor. And heat is calor. So dolor, tumor, rubor, calor. So pain is dolor. Swelling is tumor. Redness is rubor. Heat is calor. And the 5th one is impaired function of the body part. Suppose think you had a fracture and your hand got swollen. So whether you will be able to move your hand as non-injured time? No. So whenever there is going to be any inflammation, the particular part, unless and until the inflammation gets reduced, the particular point function is going to be interrupted totally or partially. Okay, so what are the 5 signs of inflammatory response? Pain, swelling, redness, heat, and impaired function of the body part. So there are 3 stages of inflammatory response. First stage, second stage, third stage. In first stage you have vascular and cellular response. Second stage you have exudate production. Third stage you have reparative phase. First is vascular and cellular response. Second is exudate production. Third is reparative phase. So what is this vascular and cellular response? Vascular and cellular response means this is the first stage of inflammation where the blood vessels at the site of injury constrict. Why the blood vessels are undergoing vasoconstriction means to prevent blood loss. So this is a natural defense mechanism. Whenever an injury occurs or an inflammation occurs, what happens? Blood flow will be there more to that particular area. So bleeding also can occur. To prevent this bleeding, what is the first step? Your blood vessels will be undergoing vasoconstriction. So that the blood bleeding will be arrested or bleeding will be stopped or it will be reduced, which is followed by dilation of small blood vessels due to release of histamine released by injured tissue. So in the injured tissues you have histamine, inflammatory mediators, histamine will be released. So this increase in blood supply is referred to as hyperemia. See, normally blood vessels at the site of injury will be constricting, but the small tiny capillaries and all will be there. No, that small blood vessels will be dilating. So what will be, and also from the injured tissue what is released? Histamine is released. So this will be increasing in the blood supply to is referred to as hyperemia, so that the particular inflamed site when you are seeing it will be what? It will be red in color. Okay, so that is called as what? Redness. And you will be having very hot because of pooling of blood in that particular area, redness. That area will become very hot. Next, there is also some chemical mediators like bradykinin, serotonin and prostaglandin and histamine as well. So what are all some of the chemical mediators? Along with histamine, you will be having secretion of bradykinin, serotonin, prostaglandin. Everything will be released in that injured area. Next is fluid proteins and leukocytes leak into the interstitial space and the signs of inflammation, swelling and pain appear. So fluid proteins and leukocytes, they will be leaking into the interstitial space and the signs of inflammation, swelling and pain occur. Pain is caused by accumulation of fluid on nerve endings and the irritating chemical mediator. So you will be having pain where you will be having accumulation of fluid and nerve endings and the irritating chemical mediators. So you will be having pain. Okay, fluid accumulation on nerve endings, due to fluid accumulation of nerve endings. And what are all the chemical mediators I told? Histamine, bradykinin, serotonin and prostaglandin. So all these will be leading to pain. Okay, so next is, in response to the exit of leukocytes, the bone marrow produces a large number of leukocytes and releases them into the bloodstream. This is called as leukocytosis. So to fight against the infection, the bone marrow, what it will be doing? So from the bone marrow only all the blood cells are formed. The leukocytes are nothing but the WBCs are released into the bloodstream and it will be coming to the area of injury or infection or inflammation. So this increased number of leukocytes in the bloodstream is called as leukocytosis. What is leukocytosis? Means increased WBCs. Leukocytosis means increased WBCs. Next is exudate production. It is the second stage of inflammation. So exudates that are produced consists of fluid that is escaped from the blood vessels, dead phagocytic cells and end products of dead tissue cells. So some amount of fighting will be taking place between the leukocytes and the injured infectious material and the chemical mediator. So as a result of this, after first stage is what? Vascular and cellular response I told. In the second stage, in exudate production, so some amount of fluid will be escaping from the blood vessels. So this fluid is dead phagocytic cells, any infectious agents, end products of tissue cells, dead tissue cells, everything will be leaking in this exudate production. So the nature and amount of exudate vary according to the tissue involved and the type of infection and the intensity of and duration of the inflammation. So the major type of exudates are serous exudate, purulent exudate and hemorrhagic. Serous means only yellowish secretion alone will be coming. Purulent means pus, along with the yellowish secretion, pus will be formed. Okay, purulent means pus. Hemorrhagic means what? Hemorrhagic means blood, that is sanguineous. It is called as sanguineous. Hemorrhageous means blood. So first phase we have seen vessels and cellular changes. Second phase we have seen exudate production, and in the third phase you have reparative phase. What is the third stage? The third stage of the inflammatory response involves the repair of injured tissues by regeneration or replacement with fibrous tissue scar formation. So in the reparative phase, what you have, inflammatory response is going to get end. That is the third stage, where the injured tissue will be repaired or it will be replaced by a fibrous scar tissue. So that you have to take into mind. Okay, so fibrous scar tissue or reparation will be taking place in the reparative phase. Next we will move on to specific defenses. Next we will move on to specific defenses. Specific defenses of the body involve the immune system. An antigen is a substance that induces a state of sensitive or immune response, that is immunity. What is an antigen? Any material or any foreign body or any infectious agent which is going to activate the immune system for producing an antibody like that, and also this is called as what? Specific defense. So the immune response has two components in it. So when an antigen gets involved, there are two types of immune responses. One is antibody mediated. So when an antigen enters, antibodies are produced. That is antibody mediated defense mechanism. One is cell mediated defense mechanism. What is this antibody mediated defenses mechanism, or it is otherwise called as humoral immunity? Next is cell mediated defense mechanism or cellular immunity. First we will see what is antibody mediated defenses or humoral immunity. So when an antigen enters into your body, antibodies are produced. From where the antibodies are produced? Antibodies are produced from the B lymphocytes, which is otherwise called as plasma cells. So this B lymphocytes are otherwise called as plasma cells. Antibody mediated defenses reside in the B lymphocytes, and antibodies are produced by the T lymphocytes. This, what is the other name of these antibodies? It is otherwise called as immunoglobulin. So immunoglobulin, you have so many types like immunoglobulin M, immunoglobulin G, immunoglobulin A, immunoglobulin D, and immunoglobulin E. Okay, so under immunoglobulins are nothing but they are antibodies. Under immunoglobulins you have so many types: immunoglobulin G, immunoglobulin A, immunoglobulin M, immunoglobulin D, immunoglobulin E. Okay, so 5 types are there. So these antibodies or immunoglobulins are produced by the plasma cells. They are nothing but plasma proteins. They are nothing but plasma proteins which act very effectively or which fight against bacterial and viral infection. Whenever a bacteria or viral infection, the antibodies are activated. So what is responsible for the production of these antibodies? B cells or plasma cells. B cells are nothing but B lymphocytes or plasma cells. Okay, so this B cells are activated whenever they recognize the antigen. So then they differentiate into plasma cells which secrete some antibodies and serum proteins. I told all these antibodies are nothing but they are plasma proteins. So whenever a foreign substance, an infectious agent, when it comes, so this plasma cells will be producing antibodies which will be fighting against the infection. So what are all the 5 types of antibodies I have told? It is otherwise called as immunoglobulins. So the 5 types are immunoglobulin A, G, E, M and D. Cell mediated defenses, cellular immunity. So this is what is done by antibodies are called as humoral immunity. So this is cell mediated defenses or cellular immunity. So this occurs through the T cell system. So here what cells are activated? T cells are activated. So it comes under T cell system. On exposure to antigen, the lymphoid tissue release large numbers of activated T cells in the lymph system. So here the T lymphocytes, the lymphoid cells will be secreting this T cells. So from the lymphatic tissues, the T cells will be secreted and it will be releasing into the general bloodstream. Okay, so when an antigen is exposed, the lymphoid tissues release large amount of activated T cells or T lymphocytes into the lymph system. Then it will be entering into the general circulation, that is bloodstream. So there are 3 main groups of T cells. One is helper T cells, cytotoxic T cells and suppressor T cells. So what are the 3 types of T cells? Helper T cells, cytotoxic T cells and suppressor T cells. What is the helper T cells? So it will be helping. Name itself tells helper. So it helps in the functioning of the immune system. Cytotoxic. Cytotoxic means toxic to cells. Cyto means cells. So it will be destroying the cells which attacks and kills the microorganism cells. And sometimes this will be killing even our own body cells. So in some autoimmune diseases and all, it will be killing even our own body cells. So cytotoxic T cells, majorly it will be affecting and killing the cells of other microorganisms. Sometimes due to unrecognition, sometimes it will be killing our own body cells also, which will be noted in many autoimmune diseases. Next is suppressor T cells. Suppressor T cells which can suppress the function of the helper T cells and cytotoxic T cells. So helper T cells, cytotoxic T cells. So once the injury, everything has been gone off, once the infection gets subside, to suppress the activity of the helper T cells and cytotoxic T cells, because if it is going on acting means even the normal cells will be getting destroyed. So for reducing the activity or for suppressing the activity or function of the helper T cells and cytotoxic T cells, this suppressor T cells will be acting up. Okay, so next is when cell mediated immunity is lost. When cell mediated immunity is lost, as happened in human immunodeficiency virus HIV infection, that is AIDS, an individual is defenseless against most viral, bacterial and fungal disease. Cell mediated immunity is very, very important. One disease condition, that is in HIV infection or in AIDS, acquired immunodeficiency syndrome, this cell mediated immunity is getting attacked. Once this cell mediated immunity gets attacked, what is happening? That's why in AIDS patients and all, there are more type of opportunistic infections, bacterial infection, fungal infection, viral infection. All infection has been, the individual has been prone because of the lack of this cell mediated immune response. Hope this video has given a detailed explanation about the body defenses. Under body defenses, we have seen non-specific defenses, specific defenses and inflammatory response. If you still have any doubts, you can feel free to post your doubts in comment section. As I have told earlier, my previous videos link I have given in description box, suggested end card and iCard, or you can watch our channel playlist Nursing Foundations for more nursing foundations related videos, question paper related videos, and 4th year we have posted for nursing research and statistics and all. So you can watch it and you can get benefited. Thank you friends. Keep supporting to Science Easy Tech channel.